Welcome to today's Healthline webinar from the American Association of Kidney Patients, titled The National Living Donor Assistance Center, Overcoming Disincentives and Barriers to Living Donation. Thank you for joining us today. My name is Jerome Bailey, and I am AAKP's Director of Patient Engagement and Advocacy. AAKP Healthline webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are needed and designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. We built this center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We encourage you to respond to our flash surveys and other engagement opportunities that you receive via email as a member of AAKP. As the oldest and largest independent patient-led kidney patient organization in the U.S., AAKP is proud to host this webinar as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP is a champion for full patient choice, the protection of the patient-doctor relationship, and the elimination of barriers for patient access to available treatment options. Today's program is very exciting as it features a discussion about overcoming disincentives for people who wish to be living kidney donors. Our presentation today will share information about the history and mission of the National Living Donor Assistance Center, who is eligible to participate in the program, and the types of assistance the program provides. We will also hear from a living kidney donor who will share her experience of working with the program. Now let's get started. It's my pleasure to introduce our first speaker for today's webinar, Aimee Walz. Ms. Walz leads the National Living Donor Assistance Center's outreach efforts, engaging the transplant community to improve awareness and utilization of the program. She is responsible for the organization's educational materials, gives talks about the program, and advises transplant centers on how to increase their usage. She also participates in the processing of applications and provides funding to living donors. Before joining the National Living Donor Assistance Center in 2022, Ms. Walz worked as a licensed clinical social worker at the University of Pittsburgh Medical Center Transplantation Institute. Welcome, Ms. Walz. I'll turn things over to you.
Thank you, Jerome. So just to start off, I just want to give a little bit of background information on the program and how it came to be. And if you could please go to my first slide. National Living Donor Assistance Center, it's also very fondly referred to as NELDAC. So if you hear me say NELDAC throughout this presentation, I am talking about the program. NELDAC is a program for living organ donors funded by a grant by the Health Resources and Services Administration. It's administered by the American Society of Transplant Surgeons, along with the University of Kansas Medical Center and Arbor Research Collaborative for Health. NELDAC's mission is to reduce the financial disincentives to living organ donation. We operate a nationwide system that provides reimbursement of travel and subsistence expenses, lost wages, and dependent care expenses to people being evaluated for and/or undergoing living organ donation. The costs of the process can be a burden for donors and recipients, and for some, these costs might make living organ donation impossible. Therefore, the National Living Donor Assistance Center exists to provide access to transplantation for those who want to donate but face financial barriers in doing so. Priority is given to those who could not otherwise afford to donate, and we primarily are aimed at assisting low to moderate income households. There are two laws that affect NELDAC's operations. The first is the National Organ Transplant Act, also referred to as NOTA, which states that living organ donors may be reimbursed for travel, housing, and lost wages. It also prohibits the buying and selling of organs. The next law is the Organ Donation and Recovery Improvement Act, or ODRIA. It states that federal funding can be used to pay for travel and other non-medical expenses if none of the following can be reasonably expected to reimburse a donor. And that includes an insurance company, a state program, or the recipient of the organ. And what we want everyone to take from this slide is that the recipient can assist their donor financially with any out-of-pocket expenses they come across as part of the donation process, as long as there is no financial gain or incentives. These next two slides are going to show some of the dates that are important to NELDAC. I just touched on NOTA, which was passed in 1984, and ODRIA, which passed in 2004. And then in 2006, NELDAC was awarded the grant by HRSA. And when our program first existed, we only covered travel expenses. And our first travel application was approved in 2007. Since that time, we have continued to assist donors and their caregivers with their travel expenses. But on November 30th of 2020, an exciting addition happened when we launched our Lost Wages program. We saw donors who maybe lived close to their transplant center and didn't initially feel the need to apply for the program for travel, but now they were interested in and able to apply for lost wages. Our eligibility guidelines were also expanded at this time, and they increased from 300% of the federal poverty guidelines to 350%. And then in February of 2021 is when we launched our dependent care program. And then in May of 2022, we launched our self-service portal. So prior to that date, applications were completed on paper and submitted to the transplant center, who would then enter the information on behalf of the donor and recipient. This new system now allows the donor and recipient to enter an online portal where they can enter their own information and upload their own documents. And we've seen that really help to decrease the work burden for transplant center filers. Now getting into some of the details of our program. So NELDAC can currently assist living organ donors with their transportation costs, lost wages, and dependent care expenses. And I am going to explain a little bit more in detail about each of these programs. The travel assistance portion of our program includes hotel, food, and transportation expenses, which includes things like gas, airfare, luggage fees, rental cars, shuttles, Ubers. We pay for travel expenses for the donor with an American Express card that is sent to them in the mail once their application is approved. Donors can also use this card to pay for the travel expenses of a support person who accompanies them on trips to the transplant center. This is just to show you what a typical travel budget looks like. It's divided up into evaluation, surgery, and follow-up trips. We are very flexible with budgets, and we can always make changes to the budget in order to adjust to the donor's need. For the Lost Wages program, we can cover up to 3 days off work for evaluation appointments and up to 4 weeks for recovery after the donation surgery. We can also cover up to 2 weeks off work for the donor for follow-up appointments, or if a complication occurs within 2 years after the surgery. Wage reimbursements for evaluation and follow-up appointments are deposited around the time of the appointment. The surgery and recovery wage reimbursement is added after the transplant center confirms the surgery is complete. To receive reimbursement of lost wages, donors must be working for pay at the time of their donation surgery, and they need to submit clear documentation of their current wages. And only documented reported income can be reimbursed, which means that we are unable to assist with wages that are paid under the table. And some people who are considering living organ donation have caregiving responsibilities for a child or disabled or elderly adult. And donors who are approved for help with dependent care expenses can receive up to $420 per week for child care expenses and up to $504 per week for adult care expenses caused by their donation. Donors can request reimbursement of these expenses on the same trips described in the lost wages section. And both lost wages and dependent care are deposited by direct deposit. We also offer a less popular option, which is receiving this funding by check and then sent to the donor in the mail. The most a donor can receive from NELDAC is $6,000. That money can be used for just one of the programs, or it can be spread across all three. A donor can indicate how much of the funding they would like to reserve for lost wages and dependent care, as well as the travel program. To be eligible for NELDAC funding, the donor and the recipient must be U.S. citizens or lawfully present residents with their primary residence in the U.S. or its territories. They must certify compliance with NOTA by signing the attestation form that is a part of our application. And they also must provide a copy of a document that confirms their household income. A donor's eligibility to receive funding through NELDAC is based upon the recipient's household income. Our income guidelines are currently set at 350% of the federal poverty guidelines. This chart's available on our website, and we do update it yearly. And according to US Census data, we estimate that approximately 67 to 70% of US households will fall within that 350%. We do, however, have a pathway for higher income recipients. So if the recipient's household income is a little higher than what is shown here, but they would have trouble reimbursing their donor's expenses, they can complete a financial hardship waiver worksheet, which allows the recipient to enter monthly medical expenses for their household, such as insurance premiums or medications costs. These expenses are then deducted from the recipient household income in hopes that the lower income will be within our eligibility guidelines. There are two ways to submit applications. The donor and recipient can complete an online application through our website, or they can complete a paper application, which they will then provide to the transplant center filer, who will then manually enter this information online. The filer is responsible for ensuring the application is complete and accurate and that all of the necessary supporting documents are included. We do require 2 pay stubs for lost wages and a W-9 for wage reimbursement, as well as dependent care. So once all of that information is verified, the filer can then submit the application. Once a donor is approved, we will call them to tell them about the program and follow up with an email so that they have a written version of what we talked about. We'll explain how the program works, confirm their information, and answer any questions. We then mail out a card that will be used to pay for their travel expenses, as well as tell the donor how to sign up for direct deposit. And this last slide here is just showing all of the amazing workers at NELDAC. Our office is located in Arlington, Virginia, and our main office number and shared email are both listed here. We also have a website, www.livingdonorassistance.org. You can go to this website to view the application. So we have both the donor and recipient applications on our website for download. You can also put a self-service request in to receive an application from the transplant center. We also have some informative information on our website as well, such as a snapshot of our program and brochures.
Thank you, Ms. Walz, for sharing this presentation. We'll come back to you during the question and answer period of the webinar. We'll now turn the presentation to our living donor speaker. We are joined by Aimee Martinez. Ms. Martinez did not want her father to rely on dialysis for the rest of his life. She went through a thorough medical evaluation to learn that she could be his kidney donor. Ms. Martinez needed some help to alleviate some of the financial burdens associated with being a donor, so she turned to the National Living Donor Assistance Center for help. Ms. Martinez joins us to share her story. I will turn the call over to you. Thank you for joining us.
Hi. So I guess it was a little easier for me. I live about an hour away from the transplant hospital. I work for the state of Texas, so it didn't really require too many resources. But it did make it really easy having a card, this credit card or whatever to use. Used it a few times for gas, for meals. It's very easy. Donated to my dad. He actually was for maybe about a year. He had several complications, a lot of health problems um, leading to that. And so he had a stroke about 6 months before the surgery in 2019. And it really affected him. But, he was able to get better. He had to go to rehab. He did dialysis in rehab for about 2 weeks to a month. Um, when he got out, he also had to go to a dialysis center. Um, that was really hard on him, but thankfully they were able to get him to do in-home treatment, so he was able to do dialysis in-home, considering his complications. So yeah, it was really easy. The I would take him to his appointments for the kidney transplant hospital. Never really intended on checking to see if I was a match. And then, I don't know, one day just hit me that I should at least try. No one else in my family would be able to see if, it was a match or not. So it all just went really fast. I went to the hospital. They tested me, found out fairly quickly that we were a match. And, within a month, we had already had surgery. And, my dad was able to make a really good recovery. He is the best health-wise he's been in pretty much his whole adult life. So yeah, it really changed his life for the better. It changed my life for the better. It made me feel like I wanted to be healthier and make better choices for myself. Yeah, that's really about it.
So, Aimee, were there any expenses related to the donation process that you incurred that were not covered by NALDAC?
No, most expenses were covered. Like I said, gas, didn't have to worry about that. Um, Meals, we didn't need to use a hotel. Like I said, we only live an hour and a half away. So I didn't really have to pay for anything out of pocket. Everything was very smooth, very easy. Um, the whole time I felt very comfortable. The nurses and the doctors were all very nice. Nothing ever really came out of pocket for me.
Uh, how did you learn about NALDAC, and who helped you through the process of, filling out the applications to receive the funding?
So with taking my dad already to his appointments, I was with him. He's disabled, so he can't drive. So I would drive him to his appointments to San Antonio to the transplant hospital, and just being with him every day, going into his appointments. Um, they asked, there was a pamphlet. I'm sorry, I'm trying to remember. It was a few years ago. There was a pamphlet about a living donor. Like I said, I never really considered it. I didn't really see it as an option per se, but found a pamphlet, asked about it. They kind of gave me a folder, told me, how it would work. I could get tested. If I, wasn't a match, then they would find somebody else that was for him and see, how that could work. But so yeah, it was actually at the transplant hospital that I was able to get information, and they gave me everything that I needed. Their folder with, brochures, you know, they, made sure that I would know expenses wouldn't come out of my pocket. And I mean, it was all very easy. They were great at providing the information.
And did you have to complete the application yourself? How did that work for you?
Um, yes. So with the folder that they gave me, the brochures and everything, I filled out the application myself. Um, like I said, it was very easy because I would take him to his appointment. So I was there already, filled out the applications, gave it back to them. Um, I had appointments for myself. So, that was easier also. So I submitted my applications there, and um, had evaluations of, sorts, and yeah.
And last question, what suggestions do you have for others considering donating an organ to a loved one, but who don't have the financial means to take unpaid time off from work?
Um, I would just say, I mean, reach out to family, anybody that is able to help. I was very fortunate in my situation, but the credit cards that they give you, just use the resources that you have. Um, Meals, lodging if you need it, travel, just use the resources that are there.
Right. Thank you, Aimee. Let's turn to Emily now. So, what information can the clinics give to patients and family members considering living donation regarding the risk to the donor?
So anybody, again, this question is probably mainly for a medical professional, and they can probably give you a lot more information. However, having experience previously working at a transplant center, there is a very in-depth evaluation process for the donor. There is a psychosocial assessment where they discuss risks. There's an independent living donor advocate who works with the donor and really discusses with them any of their reservations that they may have throughout the process. And even the surgeons talk very strongly about the risks associated with donation. So there's very many aspects as a part of the evaluation where they will be provided with information on risks associated with donation. And one of the things I always remember one of the surgeons I previously worked with telling me was that he never tells a donor that this is something that they're going to benefit health-wise from. So I don't think many donors would go into donation thinking that they're going to improve their health, but they are very strong about telling them that there is really no benefit to their health by doing this, and they can answer any questions about the surgery itself so that that donor can really make a good informed decision about their decision to proceed with donation.
Yeah. This next question came from someone who works at a transplant center, and she asked, is this a process that the transplant center works with uh, NALDAC, or does the donor need to go directly to NALDAC?
So the majority of the donors that we work with have previously spoken with their transplant center before coming to us. We do have some donors and some recipients who found us just by doing a simple web search and came across our website and wrote to us on our little contact page asking questions. But the majority of the donors and recipients that we work with have first outreached to their transplant center. Most of the time, they're already in the process of being evaluated. And part of the process for evaluation for many transplant centers is educating the donor about the NELDAC program. And that reason is that the donors are able to request funding for their travel expenses to go for evaluation. So we can cover any pre-surgery appointments that that donor might have. That would include the evaluation appointment, pre-op testing, lab work, COVID testing, anything they have to do prior to surgery. So we encourage people not to wait until after they're approved as a donor, because they are really missing out on funding that they could receive prior to being evaluated. So we do encourage donors to apply early. For most applications, we take about 7 to 10 business days to process. And for those applications where the recipient is over our income guidelines, we do require a vote from HRSA on those applications before we can process those, and those can take up to 14 business days to be processed.
Thank you for that. One last question. Can you quickly go over again how someone can apply to receive help from NALDAC?
Sure. So it mainly begins at the transplant center. So most transplant centers are working directly with the donors and the recipients on applying for assistance through our program. Depending on what the donor and recipient want to do, they can either apply on paper. In that case, the donor and recipient would be given their own respective portion of the application to complete. They would fill that out and provide it back to their transplant center filer, along with any income documents that they have to support their application. The transplant center filer would then input the information into our online system and submit the application. If the donor and recipient choose, they can also apply on our online portal. So that allows the donor and recipient to just type in their information directly into our website and then upload any of their documents to the application. Once that is completed, we send an email over to the filer just to confirm that all the information is accurate, and then they do go ahead and submit that. And it's a pretty simple process. So either way, the donor can either do the online process of submitting the application, or they can submit through the paper version, whichever they prefer.
Thank you. I appreciate that. That going over the process again.
Mhm.
So I want to thank you, Ms. Walz and Ms. Martinez, for your presentations today. A lot of good information, very informative. If anyone watching has any additional questions for our speakers about today's webinar that we were unable to get to, please send those questions to info@aakp.org, noting the webinar title in the email subject line. I'd like to close today's webinar with a few slides on additional resources that may be of interest to you. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients, their family members, as well as living kidney donors. To become a free member, join online at aakp.org or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our webpage at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download, including our Understanding Kidney Transplantation brochure or our Conversation Starter, questions to ask your healthcare team about choosing the right therapy for you. You can also order materials by phone. AAKP, alongside allied partners, the American Society of Transplant Surgeons and American Society of Transplantation, recently released a joint statement of policy principles and solutions on living organ donation. We encourage you to read this statement if you haven't already. We also encourage you to visit the AAKP Action Center, where you can become engaged and educate policymakers on how their decisions impact your life as a kidney patient, care partner, or living donor. The AAKP Action Center provides an opportunity for you to make your independent voice heard and ask Congress to protect living organ donors from insurance discrimination. You can also take action today by signing a petition or by sending letters to your member of Congress to urge them to sponsor this important legislation. We are excited to announce the dates of our 2023 events. The 5th Annual Global Summit on Kidney Disease Innovations in partnership with George Washington University School of Medicine and Health Sciences will be a hybrid event, both online and in Washington, D.C., and will take place June 28th and 29th. The 6th Annual Policy Summit will take place virtually on July 28th. The 48th Annual National Patient Meeting will take place virtually September 20th through the 22nd. And the 5th Annual AAKP Fun Walk will take place virtually December 4th through 8th, with an in-person walk in Tampa, Florida on December 9th. We invite you to let us know which events you are interested in participating in this year. We will be sure to notify you when registration is open. You can also visit our YouTube channel to watch presentations on demand from our 2022 events and programs. As we close today, we again like to thank Emily Walz and Aimee Martinez for participating in today's AAKP Healthline webinar. Thank you all for joining us.